Hi, I'm Dr. Scott. I'm going to talk to you about how you go about having veneers done. Well, there is actually a lot to do with veneers that's done before the first appointment because we have to spend a lot of time figuring out exactly what we're going to do. There's often a lot of conversations between the dentist and the technician before we actually begin. But let's imagine we've made the decision, we've done all the planning, and we're good to go with the veneers. Well, then it's usually done over 2 visits. Visit 1 is 60 minutes long, and then there's usually a 2 to 3 weeks gap, and then the second visit is about an hour long as well. In appointment number 1, we do some minimal preparations of your teeth. With veneers, unlike crowns, the preparation is usually just on the front part of your teeth. It doesn't go all the way around. After we've done that, we then put some temporary veneers in place so that you can smile in that 2 to 3 week period. The impression is then sent to the technician, who spends a lot of time making the perfect handmade veneers for you. The second visit is usually 60 minutes long, and it involves us removing the temporary veneer and then fitting on the permanent veneer. But before we actually glue it into place, we have to make sure it all looks perfect. We can't just go and slap it on there. So we put it on, we usually take some photos and just make sure everything is as perfect as what we planned for. And once we're happy with that, we then glue them into place. Sometimes, and if we're not 100% happy, then we like to send them back to the lab for them to do a little bit of tweaking and then get you back in to then fit them permanently. Once they're all glued in place, you're pretty much good to go, because veneers these days are cemented in via light cure, which means you don't have to wait for 2 days, you can just start chewing on them straight away. But listen to your dentist, they'll give you specific instructions so that you can look after them the very best.